Good afternoon, everyone. Oh, great. Let's do it right. Let's do it right after we introduce ourselves. So we're going to have everybody on the dais introduce themselves, and we're going to start with Ignacio.
Ignacio Guerrero, Director for the Department of Child Support Services.
Bob Minicucci, Social Services.
Good afternoon. Rob Coelho from County Counsel's Office.
Cindy Chavez, member of the Board of Supervisors.
Dave Cortese, Board of Supervisors.
John Mills for the County Executive's Office.
And Dave, thank you. And Dave, did you want to introduce your guests?
Thank you very much. We have a couple of guests today from tax-paying families in this county, and they are here shadowing. They are both students at Kenya Heights Academy, right? And I'm seeing nods of the head, so I got that part right. Joe Winters, raise your hand, Joe. Why don't you both stand up? Joe Winters and Jimmy Campagna.
Welcome.
Thank you. We're inundating them with information, so they're doing a great job. Thank you for being here.
Welcome. So we're going to now begin with public comment, and this is to speak to an item that is not on the agenda but within the purview of this committee, and we will invite up Scott Largent he is our public commenter today. I don't see Scott. Oh, there you are. Welcome.
Thank you. Ready, Frank? Thank you, Cindy. Sorry about that. Fumbling in the back there. That's why you want to come prepared when you come to stuff like this. I have been, Scott Largent, by the way. Everybody knows who I am. I have been figuring out a legal strategy right now. A lot of you know that I have always, the entire distance of my sobriety, I've always been in the process of being prosecuted for a crime. The entire time. Now, I'm somebody now that, of course, those things don't even exist. They were slap on the wrist. I have one thing left right now, which is a megaphone charge. But now that it's because I am being charged with a crime from our DA's office for such a long time, and it kind of shifted all the way around, I cannot get services from the DA's office. I cannot use victim services, and I have been the victim of a crime. I mean, just walking in and out of San Jose, something's bound to happen. I cannot walk in there and get any type of help with that. I cannot get any type of information, feedback on the civil matter that I'm involved with now with our county. Of course, with the county getting restraining orders against Susan Bassey. They can't answer a single one of my questions. They keep trying to send me through the county attorneys, but they don't represent me either. So think about it right there. And they keep trying to send it through the criminal attorney that I've been assigned through the county. He represents me on a criminal level. He doesn't represent me on a civil level, a family law level, none of that crap. So every time I go down to that office there, I call him on the telephone, I get very, very frustrated. I bring all the different megaphones. I say, hey, I want my questions answered. So what I decided to do, I'm trying to become my own lawyer down there at that law library. I absolutely can't stand that place, but I have to do this. I'm going to fire my attorney. Now, if I fire my county IDO attorney, there is no reason that office down there right now can't provide me victim services, discuss my family law matter, maybe even prosecute my ex for the 166 violations that she committed for 2 straight years not letting me see my child. Maybe they would provide me the victim compensation insurance fund that would provide me with counseling. When I wasn't able to see my child for a month, click that green light right there, I should have been able to have sat down with a therapist rather than coming in here. Okay, this has been going on way, way too long, and it's sad that a member of the public has to go self-represent to make this happen. You guys should start waking up to this right now. You should know that something's wrong, something stinks. The easiest thing they could have done out the gates is assign me a family law attorney to protect my rights. They should have just told me, hey, Scott, you got pending criminal matter, push it out 6 months, then go in there and get hung. That's what's going on right now, and I just don't agree with a lot of this stuff. We'll see what happens. And I don't want to make a circus out of this stuff. I just want the proper services our county should be helping me with. So thank you.
Thank you. Tim? And this is on public comment, or it's item 4? Okay, let me just change that. Thanks. So we have no more public comments. We're going to now go to approval of the consent calendar and changes to the agenda. So what I would like to recommend is that what we put on consent is item 8, the Deb's annual report, item 9, the Second Harvest Food Bank, or actually, is that what it is? Let me just, oh, thank you. And then we're deferring the Human Rights Commission relative to a request from staff. And if we could take those actions, I just wanted to make one comment on one item. And Dave, do you have any other recommendations you would like to make to the agenda?
No, I'm agreeable to that. And did we also have, besides 8 and 9, the pre-existing consent, the 14 and 15? So if you want a motion, we can move 8, 9 along with 14 and 15, which were already on consent, and then ask that Human Rights Commission be continued to the next board meeting, the next commission meeting, I assume? Committee meeting? I'll get it
Yes.
right.
Yeah, I'm sorry, my numbers are a little off here, so,
Okay.
got it.
8, 9, 14, 15, and 11 is continued.
That'd be great. And then the comments I wanted to make on item 9 is that I just wanted to say how much I appreciated the staff report. It was super clear, and that's why we don't need to take it off, but also just to say to your staff, Bob, on CalFresh Outreach and Second Harvest, just congratulations on a job well done. So if there are any staff here for that, really good work. And then on item 8, the Deb's report also was excellent and very, very clear. The only request I wanted to make is that I'm very interested in us having a conversation about the Intern and Earn program and the ADP, the usage of ADP, and really what I'm interested in taking a look at is how we continue to embed financial literacy and banking as part of that program, because I think the whole issue we're having with ADP really has to do with making it easier for young people who aren't banked. But I'm also interested in whether or not there are other solutions relative to ADP. And Bob, I don't know if you have any ideas about the best way to proceed on that.
We can definitely put something together and bring that back to you.
With some options and ideas, okay. And to say to the staff, I know they feel very strongly about ADP, like that's a good direction, and I'm not yet sold, I want to be sold, so what I'm looking at is both getting your feedback, better understanding why, and then what are options. And then the other thing is just whether or not we need to think about customizing options based on where young people are in their own financial literacy as well. All right, so we have a motion from Dave and a second from me, and that passes. And we're going to go then to item 4, and this is the San Jose Family Resource Center. I'm sorry, yeah, San Jose Family Resource Family. On this item? Yeah, I was going to let the staff, so let me just talk about process. I was going to let the staff make a presentation, then go to public comment, and then to board comment. Thank you. Welcome.
Hi, welcome. I'm Dan Little. I'm the Assistant Director with Department of Family and Children Services.
Good afternoon, Dave Barry, Chief of Facilities Planning, FAF.
Deborah, you're, I don't think your microphone's on.
Good afternoon, Deborah Porche Usher, Chief Deputy Director, Social Service Agency.
Hi, so I'd like to start just with a broad overview of some of the items contained in the ledge file, and then I'll go through some of the specific questions that I think we've received. So the first information I'd like to discuss is the specific services and staff that are currently available at the 591 Kings Road and will be also available at the new location at 353 Julian. So for services, these are going to be specific for DFCS clients. So these are for clients that are currently served by the department. There is a parent orientation that's conducted by DFCS staff for new parents within our system. There is a Parenting Without Violence, and then there's child supervision, which is a contract with CAFPA to provide supervision for those parents that are participating in those classes. We also have 2 external providers that provide services. within the Family Resource Center. And then we have other additional kind of miscellaneous community meetings that occur within 591. Going into transportation, so we did some looking at the current parents and clients served at 591 to look at the distance that they're having to travel. The 591 Kings Road is at 95133 zip code. Our two highest served zip codes are actually 95111 and 95112. 95111 is approximately 7 miles, and 112 is 1 mile. And according to the evaluation we did for last month, we didn't have anybody that identified at the same zip code as the Kings Road.
What is the zip code for King?
95133. Looking at
zip
where
code for
the
King Road,
clients
it
are
runs-
coming from, so the 591 location
Like saying there's
serves
one zip code for Highway 101.
countywide. So 69 of the clients for this month's survey were from San Jose. We had 8 from Santa Clara, 3 from Sunnyvale, 2 from Morgan Hill, 1 from Palo Alto, 2 from Saratoga, 1 Mountain View, 1 West Menlo Park, 1 Santa Cruz, and then 2 were identified as homeless. The majority of the clients come from the greater San Jose area. And then one of the items that we really want to start looking at is how can we connect, truly integrate with our community through the family resource centers. So on the screen is a map of the FRCs that are identified by First Five. So these are the sites in and around the county that are true community partnership sites that we have opportunity to collaborate with to both co-locate services as well as to co-locate staff. So I think with that, I'm going to jump into some of the specific questions that were asked, and then I'll get into some more details regarding the family resource centers. So one of the questions is looking at what kind of languages are provided. So for the DFCS specific services, so that's the Parenting Without Violence and Domestic Violence and Parent Orientation. Parent Without Violence is provided in English, Spanish with Vietnamese as well. The Domestic Violence Women's Support Group is in English and Spanish, and Parent Orientation is English and Spanish with Vietnamese as needed. And then the additional groups, so the Mothers Empowerment Group is in English, Al-Anon is in Spanish, and the Neuroticos and then Nemos is in Spanish.
Wow.
Regarding the moving of the services, all of the existing services at 591, with the exception of Al-Anon, will be available as they currently stand at 591. So all those exact services with the same providers, the same staff, the same language capacity will be available at the 353.
When you say 353, are you talking about Julian
I'm sorry,
versus
at
King?
353 Julian.
Okay, so
Yeah.
we'll just say Julian and King.
At Julian. So the same
Okay.
services are at King Road will be available exactly as they are at Julian. The one exception is Al-Anon, who's decided to partner with another provider to get co-located within the community. But all of the other services as they stand today will be available on Julian.
And when
Again,
you say within the community, what do you mean?
I think that they're working with Conexion to see if they can get within a site. But
It'd be community-based versus...
community-based versus a county-based location, correct.
Geographic.
Yeah, I just thought it was interesting language to say community versus the county, which I think is actually one of the issues.
Community-based, community-located versus a county-run business.
Thank you.
Yep. So there are questions about access and the hours. The Julian campus will be available Monday through Friday, 8 a.m. to 9 p.m., and then Saturday, 8:30 a.m. to 2 p.m. There are a question about transportation. So I know that one of the points that we're working at was the access to the VTA at the Julian campus, and that's something that facilities is still working on. In the meantime, we will utilize every one other option and resources that we have. There are currently other programs that utilize additional transportation, such as reimbursement for gas, reimbursement for transportation such as Uber and Lyft, bus So those will be available. So transportation to the Julian campus will not be a barrier for families to access services. We will make sure that there are plenty of opportunities for transportation to eliminate that as a barrier.
Can you say more about that? What's the service we're going to use to do that?
So I know that there are some other departments that offer either reimbursement if people self-pay to do Uber or Lyft. I know that there are some people that provide reimbursement for gas. So that's something that we can look at either providing reimbursement. We're also looking at additional to have staff on site that can help with transportation. And Deb, I don't know if you want to provide additional.
Thank you.
So we're also looking at what is the probability and the opportunity we have to have county staff provide shuttle service back and forth between the Deer Down Station and that. So we have to cost that out. We also have to begin to look at the labor that's required to support that.
Yeah, I would think that would add an expense that, I mean, we're having a big conversation about how we don't have money right now, and so it's an interesting proposition you're raising.
Yes. But something that we're also exploring to present as an option.
Great. Dan, I'm sorry, anything else?
No, I think if there's any additional questions, feel free to answer. Yep.
Thank you. I think my basic question is that the analysis that we're currently looking at now, I just want to affirm that that didn't occur prior to the last 60 days. Is that accurate? Deborah, I think whenever you hit it, you do the opposite. Yeah. Okay, there you go.
The analysis has happened in the last 60 days, and we're continuing to do surveys out to the community. But what you have preliminarily is surveys that were sent out to the parents, and about 90 responses received. There's also the effort to I think this week to send out additional surveys and information related to the relocation and also the service needs.
I guess the point I just wanted to make is that we took these actions prior to talking to the staff and really even more the community. And I'm more saying that not as but more to just make the point that it's not really the way we want to do business. I think especially in the kind of services we want to provide that are community-based. Now, I will say I've also explained to people that part of the reason we had to get out of that building is we've had such a terrible relationship with the property owner, and in fact, part of the reason we're building the hub is because they wouldn't let us put a sink or a shower or anything else we wanted to do for the kids in there. So I'm not decrying the idea that we're leaving that location. I mean, we're leaving that location. I'm more concerned about the how we did it and then the where we go. So I'm assuming, Dave, you're sitting here to talk about the other issue that we raised with FAF in terms of alternative locations.
Yeah, so it just recently came to our attention about a possible location near, let me see here, at the Evergreen Medical Center. That's located more towards, I believe, Eastridge. So we have reached out to the property owners there, and my real estate staff are looking into that location. It's a 42,000 square foot building, private state-of-the-art integrated outpatient healthcare delivery center. And so we were looking at what does that facility look like, and could it accommodate the Family Resource Center?
Yes, and I just want to raise one point about that, and then I'm going to just go to the public, and then I'm sorry, I'll come back to questions. Is that okay, Dave?
Absolutely.
And that is that on the 18th of September, I believe that Supervisor Cortese asked that we look specifically at those locations. I understand that that information just got transferred to the department, your department, today.
That's my understanding. I don't know about the original referral. I just know
You
that
heard about it today.
I heard about it today.
Yeah. All right. So we're going to go to the public, and we have a few speakers on this item, so everybody will get 2 minutes. And I am going to take these in the order. I think I got them. Mary, and actually you can come up in any order, but Lourdes, Ruth, Tim, Scott, and Marcella. And just if you could introduce yourself. Welcome.
Thank you. So my name is Mary, and I'm one of the supervisors at the San Jose Family Resource Center located at the 591 North King address. I've been there for the last 3 years, having come from the Julian facility after 15 years. And I've seen a stark difference between the services offered directly to the clients at the 591 North King Road, because it's an easy location, it's one story. Clients can walk in and ask for, assistance. It's such a much better ambience, better access. I think overall, there have been better outcomes for the clients of the Resource Center, because we mostly do voluntary services, it's not court services. The Julian facility for us is more corporate, not as appropriate for clients who are already going through a lot of trauma because of the children and the involvement in the system. So that's all I wanted to share. Thank you.
Thank you.
Hi, my name is Lourdes Gomez. I'm a DFCS social worker. It is clear that a move from the east side to the Julian campus indicates a contradiction instead of an expansion of the Family Resource Center operated by DFCS, a glaring contradiction to the stated goals of DFCS. Perhaps DFCS needs to look at First Five as a model of SWIFT, evidence-based and rapid provisions of services provided with the communities and for the communities. Our clients are one and the same. The needs of the families and communities do not end at the 6th birthday. It is essential that we keep the San Jose Family Resource Center to address the needs of the children and families of all ages in the county. On behalf of the frontline workers throughout DFCS, we ask that you please stop this move now. Thank you.
Hello.
Hello, good afternoon. My name is Ruth Larson. I've worked for DFCS for almost 20 years as a case-carrying social worker. I started at the Children's Shelter. I wanted to highlight a couple of the written submissions. One of them is a very detailed report that gives point-by-point response to the report that's been submitted by the county. It's response and comments to SSA Report 98749. I think one of the most glaring points that I would like to make right now is First Five. It's ages 1 to 5. We serve ages 1 to 18. So right there, read between the lines, it's not serving all of our clients, okay? So this kind of ad hoc, we're going to do the First Five thing, it doesn't make a lot of sense. So there's also 2 written submissions of letters from San Jose Family Resource employees that I'd like to highlight that have been submitted for part of the record. So I just refer you to that very detailed report for our further responses. Okay, thank you.
Thank you.
I'm Tim Willett. I'm a member of SEIU, taxpayer, registered voter. I'm going to keep this kind of short because it's a pretty basic problem. The Family Resource Center should stay in the community. You put the resources in the community, right? You put the resources where the people are, right? You don't take the resources away from where the people are. So that's why the Family Resource Center should not be relocated. That's the reason why it was there in the first place, right? Because that's where the resources go. You go over to where the people are. The fact that after raising the concerns of the workers and the community members, we still do not have a solution is worrisome. This is why we, SEIU 521, are on a ULP strike. Please address the issues in DFCS and throughout the county so that our community doesn't suffer unnecessarily. Thank you.
Courtney, are you being Marcella?
I am.
Okay.
I'm reading Marcela's statement. Hi, my name is Marcela Cervera. I work in DFCS at the Family Resource Center. I would like to respectfully ask you to consider the impact of why this closure/move creates barriers for families who are participating in voluntary services with the department to keep their children safe, and for the case-carrying DFCS social workers in the voluntary units who serve these families. Due to the voluntary, non-court involved, and preventative nature of these services, there is no court order or authorization for DFCS social workers to enter homes. There is no court order to say that families must let social workers into the home to ensure the safety of the children. Voluntary services rely on the engagement and partnership with families in the community. This partnership is based in trust and the clients feeling safe enough to engage. For these reasons and more, it is vitally important to have a place where families in the community can come that is approachable and safe for them. While it is important to meet families in the community and in their homes, some clients are homeless, and some face the risk of eviction when strangers are allowed into the home or a room that they are renting. Some clients are immigrants and have an intrinsic distrust of government due to past trauma. Best practices tell us to engage with clients where they are comfortable to meet, while upholding obligations to make sure home environments are safe. Please consider directing the Department of Family and Children Services to keep the location of the Family Resource Center in the East Side community and stop the move to the Julian campus. Thank you.
Thank you, thank you. I was over at the Julian Street location today. I don't think it's a good idea to, of course, I've been reading the news articles and everything. I know what you guys are doing, and I see how, you know, we're consolidating a lot of different locations. We have new buildings. When I go up to the location there on Julian, and I've kind of watched this for a couple of years, you always see more signs telling you things you cannot do. I understand filming inside of lobbies and stuff, but they start putting up that you cannot bring your bicycle in there. And I understand we don't want weapons going in locations and stuff, but when you're homeless and you have a pocket knife and you have no bike lock and you're struggling, you need to bring that bike in there. You need to bring that backpack. That's everything you own. But that's all we do. We put all these things up there that you can't do this, you can't use that. You walk over to use the restroom. I mean, what do you got to start putting quarters in that thing? You need a little scan badge. It's not very friendly of a location. And we also have over there, I believe, the Independent Defense Council office is there, but they're really not even there. You go into that lobby, you ask, they don't even know who they are. They don't even know what floor they're on. They don't even know what telephone number. So it seems very confusing there, and it's not really funny, but today I filmed a video, and I'm walking down the trail right there, and I turn the GoPro over to social services buildings, tall, beautiful, big buildings, you know, it's just unbelievably beautiful. Veer that thing over to the side, and there's a man, you know, dropping a deuce right there in the creek. It looks like a third world country on the other side of the fence. How are we not even seeing that? Most of you all have cars, jobs, you're not dealing with it on a street level. Take the bus one day, walk behind social services, walk downtown. Don't stay in the high rent district on the other side near the Hyatt. See what it's really like. Thank you.
Thank you. Thank you all for coming to give your comments. And Dave, do you want to make any comments, or do you want me to start, or how would you like to go? Go ahead.
I might have a comment, but I'll defer to you after the question. It's just more a matter of confusion, and it's probably, I'm guessing, not going to have a big bearing on any final decision, but in the presentation about the zip code, specifically the zip codes that were identified as King Road zip codes, they didn't make any sense to me in the sense that King Road has a number of zip codes running north and south, I think, for approximately 10 miles from the southern end of King Road to the northern end of King Road. We've often referred to that corridor because it's a transportation corridor and a major collector that moves north and south with almost as a secondary collector to Highway 101. So I just wanted a clarification as to how you came up with that. I mean, it wouldn't surprise me if half an hour later from now we hear somebody reporting on the 95122 on the King Road corridor, you know, for other reasons. But is it possible it's just a mistake, or is it, did you draw, is what you're really saying is you drew a radius around the facility taking in King Road, and that's the zip codes, or I'm not clear on what you're saying there.
That was just the zip code for the immediate building location. The actual zip code that shows up for the address for the building.
Yeah, and I think, okay, so then to clarify what I don't want to speak for Supervisor Chavez, but we have complained about here and what goes back to the September referral that she was referring to earlier in terms of trying to find locations along the King Road corridor, which I think by most accounts, East Ridge is considered to be part of that corridor, basically running between Capitol Expressway and 101 north and south, like I said, for about 10 miles. It's our concern that is essentially the geographic population we're concerned about, making these services available to as conveniently as possible, and whether or not people are coming currently from those poorest of census tracts that are on the southern corridor of King Road, 95122, 95121, 95148, 95127, they should be looked at, because it could be a self-fulfilling prophecy to put these services in a location, including the current one, which may be inconvenient for some reason for folks to get to from that corridor. I think we should be looking at is the census tracts and the communities of concern, both defined federally, like we do with our transportation agency, and say how do we best geographically center ourselves, to assist those populations. And then, clearly with Al-Anon or any 12-step program, it's almost completely geographic. People who go to 12-step meetings either go there because they're inclined to go there for convenience and because of sort of a geographic community, or they go as far away as possible for anonymity, away from their neighborhoods. It's really only two decision points, generally speaking, there. So it doesn't surprise me at all that they would want to stay geographically close to where they already are, as opposed to just trying to merge with, a downtown Al-Anon group or something like that. So I don't want to. It seems to me there's a synergy having those programs in the same place where we're having family-serving programs because of drug and alcohol issues and so forth. So it's bad to lose them and have them peel off like that, but I fully understand why they would do that, and I think it's probably most consistent with the general concerns that the committee has been expressing about trying to keep the synergy of services available, particularly to communities of concern and geographically convenient to where it is now. So I guess that was my question and comments all in one. Thank you, Supervisor.
Did you have any thoughts or response? Or Bob? Sorry,
Yeah,
I didn't see your light on, Bob.
I'm happy to jump in. I think the issue, as we said before, our approach to this was to take a look at how we can partner in the community. And as folks mentioned, there's the first 5 piece of it. The family resource centers that are out there, just to address that issue, don't literally stop at age 5 or 6 with folks. These are resources available to the entire community. But within the zip codes that we're talking about, just talking about first 5 family resource centers, not including any other kind of EAN location that's in the community. Just first 5, in those zip codes, there's 13 locations that are there. And our aim was to embed in the community with them. And in addition to that, we would potentially join in with CBOs and the emergencies, the EANs, as part of that co-location piece. So
then if that's the case, Bob, what would be located at Julian Street versus, from the...
Right. So the Julian location, as we're just saying, is convenient to some folks. When we looked at the survey that was mentioned, the average distance to King Road for folks was about 8.2 miles. The average distance to the Julian campus was actually like 7.8, 7.9 miles. So it's essentially the same. And for some folks, that's going to be a more convenient location. We would continue to do services out of there. But what we wanted it to be, when we said this last time we were here, was really about bringing the staff together into a central location so that the staff can work on and be a broader part of the teaming effort that we're trying to put together through the child and family teaming that we do and the practice model that we're currently putting in place. So there's potential for having services there, but also it's really about building the community partnership. In the ledge file, there's also the mention of the recent bill that's passed that is identifying this as a resource, a recommended resource of how we do our work, how we do our practice model. That was just recently signed by the governor. So I think there can be conversation around what is the appropriate type of community organization that we should do our partnership with. But what we've already been doing is, as part of the CFTs, the child and family teaming, and our practice model, as part of visitation, we're already putting that activity into these co-located pieces. What we wanted to do is have this follow that model.
So, so let me just make a couple observations.
Sure.
One is that I think as it relates to talking to clients about their location, post us making a decision about where to move them,
Sure.
means to me that we're thinking a little bit backwards in terms of being client-centered. Now, as it relates to the model that you're referring to in terms of having a more integrated set of services, given that these are mostly voluntary services and much of what's in the SSA building are non-voluntary services, it appears to me like when I'm going there, it's, and even the ingress and egress to it is set up for, one set of families to come in on one side and children to be dropped off from the other. I mean, it's got a different kind of feel to it. Is your contention that the new building, again, I haven't been in the lobby yet, so is the new building lobby designed differently?
I mean, no, I think it's pretty much what you'd expect for a building like that. I mean, there's touches that we have in place in terms of some entrances. There's a specific childcare area that was designed specifically for that purpose.
But you're
that's
still coming
separated.
through something that is
There's still a lobby you're going to enter.
Yeah,
and-
okay.
and go through
So,
that.
but the lobbies they're not designed for anybody just to swing in and swing out. You're not picking up information. You're not, I mean, you could from if there were some brochures
Correct.
outside, but it's not like a,
It's a reception.
right, and but it's not like a family resource center, and it's not like the resource center that
That's-
exists today.
I would say that's correct to
Yeah,
some extent.
and that's not I mean, I'm more making that as an observation in terms of how people drop in and drop out.
Sure.
So part of the reason that that we had asked, that Dave and I had both asked for to look at a location on the east side had more to do with us believing that access, particularly because the language here is primarily Spanish language, and frankly, I think it might be one of your more language-rich staffs. Is that accurate in terms of the service provision there? Because it has the capacity for Spanish, Vietnamese, and I don't know, maybe Tagalog as well in that location? At least that seems like it when I've met folks from there.
Yeah.
Is that accurate? Okay. So, from could you just talk a little bit about how the integration of that, the staff complements the family practice model, versus, and mostly because I've been thinking about them as distinctly different, and I'm feeling like I may have missed something.
Yeah. No, I mean, I think, again, what we're after here is that, from the get-go, what you're doing is working with the family, with all members that are part of a support system to them. And what we're concerned about is, to the extent that you have, a more isolated approach to it, you're creating the silos and the separation and problems for engagement with staff. The model is about all together, all at once. You figure out what you're going to do, move forward from that perspective, and we feel having the staff together supports that.
But is the silo here we're concerned about is social work staff not being able to communicate with whom particularly based on the types of programming that are in this location?
Sure. I mean, again, it's the support of all the systems around them. All the different pieces of work that are happening that touch a family's life. So between our different departments, whether it's a continuing case, the warm handoffs that can happen, the issues of like our differential response staff who are maybe deferring of folks into some voluntary services if they're over at Julian and they're trying to make the leap in over the gap to outside location. We think that doing it in a more distributed way, that folks are centrally located, can work together, do the teaming, and then go out into the community to do the meetings that have to happen.
So part of what that's helpful, and let me just tell you what I had thought the program was, and then get your thoughts on where I'm not making the connection. What I had been thinking about with this particular center is that much of the work was voluntary, like families wanting to come in. When I think about Julian Street, I think about obligatory.
Yeah.
I mean, for the most part.
Right.
Is that accurate? I mean, the way it stands now, or is there a lot of?
I mean,
besides the
yeah.
Kafka folks.
Right. I mean, there's a distinction, and I would say that's true. The voluntary nature of it isn't just like anyone. I mean, we're still touching you through some sort of referral.
Got it.
It's not just like you're like, hey, I think I need some supports. Then you might go to a community FRC. You wouldn't come to us. And that's the distinction we're trying to make.
Got it. So here's, as part of the work that we've been thinking about relative to prevention, my belief would be that as we get into a much more assertive strategy relative to prevention, that we would decidedly not be in a Julian Street location, that we would be deep in the community. And frankly, that separation is partly what I think we were looking at in terms of not getting people fearful of getting entangled in our system. Is that?
Yeah, I think we're saying the same thing. I think that's our ideal of the model. We're just not there yet. So from the standpoint of a transition, we can support providing the services out of that campus. When we can fully integrate, according to some of the new laws and all of that, that would be the vision. But our teams are still just learning this as part of CCR and the work that they do in our practice model. And there's still work to do in that regard.
But does it make sense that, doesn't it create more of an opportunity for us if we have kind of not just these partnerships with the resource families, and I do want to just make a comment. I am going to comment a little bit about First Five in just a minute, but it does feel to me that we're going to be kind of forced into one of two directions, and one direction may be to be forced into, not forced, but as we think about the next steps, as you're kind of thinking about how this family practice model is really integrated into the community, that at some point it feels to me that we are either going to have to make contracts with our nonprofit partners or have our staff integrated into the community at a much deeper level, including even looking at some sort of a drop-off center in that the location. And I'm looking at the family resource centers. This is actually a very interesting grid, but I'm thinking where from a placement perspective are we going to want to put a place that people are going to be more likely to come in? Like, what's it feel like and look like? Sure. To me, that feels much more like the Eastridge Mall, I forgot what the name of the Metaplex was, but Evergreen, but it does feel much more there than even at Julian. And frankly, even as we've been rethinking how to redevelop this site, one of the things that I've been thinking a lot about is what services can come from Julian here and what services it wouldn't make sense to put here, but may make more sense to have on East Santa Clara Street or on, Jackson or further out. So that leads me to a question, which is, do we completely want to shut down our East Side footprint relative to the county with this kind of set of services? I don't mean relative to First Five or anything else, but relative to the county. I think part of the reason that Dave and I were really interested in having that look on Eastridge is because we felt like that was moving in the opposite direction of what we were doing relative to the prevention work that you've been helping lead. Right.
Yeah. No, I think that's true at different levels. I have, different. I think our campus at some level, what's pointed out is true, but at the same time, I also think it's important what we mentioned last time, that people do have the opportunity to be there if they choose to be there. And if we can provide services out of there because folks are coming there for other other parts of their business, I think that's a positive thing. We do some visitation out of there. We do other business out of there. And I do think it's important that it's there. But as I said, it's kind of a both and
No, I
situation.
appreciate that, because what it sounds to me like would have made some more sense, and it really has more to do with two different timelines
Right.
running it, or
I-
three, right?
I-
The capital timeline running into the
I
programmatic timeline, is that it feels to me like what would make more sense would be to maintain a beachhead, so to speak, and then make decisions about the point that you raised, both with the staff and the community, about what kinds of service provision processes go in one place versus another. And so so part of the reason we had wanted to really make sure that staff had a chance to look at an East Side enclave was to be able to give the flexibility to have that kind of programmatic approach instead of making a real estate decision that's not necessarily, I mean, recognizing there's some overlap. So here's a question for you, Bob, and it's one that that I don't know the right way to talk to Dr. Smith about this, because frankly, right now I'm a little confused about how to have this conversation. But let me just make this point. So right now, the employees are scheduled to be gone by October 20-something, 6th?
5th or so.
25th. Staff has just alerted us that they just are starting to look at the Evergreen building today, which means that in the best of all possible worlds, they find something interesting, which never seems to happen that quickly as it relates to real estate, not to put Dave too much on the spot, but it feels very, to me, catch as catch can. So they find a site October 30th, and we've moved everybody on the 26th. And the deadline is a self-imposed deadline, is my understanding, in part based on real estate that we could be in for 2 more years, because we're stuck with a lease. And so, or a year and a half, I think. So my question is, if Dave's had received the direction at the time that the board gave it, or not you, Dave, just personally, but FAF, and FAF had found a location, what discussion would we be having today?
I mean, I think it comes down to what we're saying. Our plans were to proceed as planned, to be doing the move absent some specific direction from the board. So I think that's kind of the point that we're at now.
Okay. And to my knowledge, this is not on the agenda for Tuesday's discussion at the full board. We did ask for a report out, but I haven't seen the agenda, so I don't actually know if it's on there.
I don't know either.
So, on Tuesday?
It could.
It's Wednesday.
It could, yeah. The agenda hasn't been published yet.
It's Wednesday. I forgot I'm so sorry. I was tomorrow already. So, okay. So why don't we make a referral to put this on Tuesday's agenda as a board referral to direct staff to stop the move until we can look and see whether we have an option, and to get feedback from staff as to whether or not, if we had that beachhead option, what would the programs look like that you would recommend, and have that come back to the board 2 weeks from the day that we put it on Tuesday. So we'd be asking for the update on the location on the east side, and if we get a location on this east side concurrent to that, how would you programmatically structure the change in location? Is that clear to everyone?
Okay, so I'll move that direction to place that board referral on the agenda.
Great.
I'll second your motion.
Great. And you want-
Whichever works for the clerk.
Excellent. And then any other feedback you want to make sure? So what I would recommend is this report come forward, because not everybody will have had a chance to see it as the backbone. I wouldn't expect, the only thing I would expect would be, if you had a verbal update on programming. I know that's really too tight a timeline, but Dave, that you all would have an update on options for locations. But I know you're not going to, it'll have to be verbal on Tuesday is what I'm recognizing.
Yeah, so I'm only familiar with the one location that I just mentioned to you. Were there additional locations that you wanted us to look at?
So it was the
specifically?
Metaplex and also the VTA location specifically, but across the street from that, like within that four square area. Actually, you know where else we have property? I think available is on Reed Hillview's site.
Okay, so county.
Yeah, so there's four corners there.
Right, mhm.
There's the Eastridge, the eastern half of Eastridge, although there may be some other location there, but that we were looking at was the eastern half of Eastridge. Then there's the property we actually own that might be worth taking a look at, and then VTA's site there too, because VTA has their bus transit center there, but they've got an office building that they own that used to be a dialysis building, and I think only part of that building is being used right now.
Okay.
Is that right, Dave?
Yeah, we actually even casually mentioned Eastridge storefront space, but I think these were the primary locations that we asked back in September to be looked at.
Yeah, but that's a good point. Eastridge has some, I don't know what they have available, but it would be worth looking at. All right, thank you. So with that, we'll move on to item 5, and this is the seniors agenda. Welcome.
Good afternoon.
And Jim, there is no song for Happy Last Children's Family Seniors Committee meeting for you.
You didn't
but-
compose one?
No, but I'll work on that, okay, while we're here.
Thank you. I
But
appreciate it.
congratulations on your retirement.
Thank you very much. Thank you, Supervisor Chavez, Supervisor Cortese, members of the committee, Jim Ramoni with the Director of the Department of Aging and Adult Services. I'm pleased to report out our annual Seniors Agenda annual report for 2019. I actually was given an assignment by my staff of one to write up a letter to kind of highlight our accomplishments. And, you know, initially a lot of these letters that are prepared with my name are actually written by the staff or a group of staff, but I actually sat down and wrote this introduction. The Seniors Agenda means so much to me over these last number of years. It's the one program within the department that really is unlike any other social services program. It's given me the opportunity and us the opportunity as an agency to collaborate and work on so many different levels with all of the aging services providers and just other service providers who we had no idea initially when we started out that we would ultimately be partnering with and really creating something that I think we're all very, very proud. I know we're all very, very proud of. So I'd like to turn it over at this point to our project manager, Diana Miller, who really needs no introduction because of all of the work that she has done over the course of the last 6 years. And again, this report is simply a reflection of the hard work of this past year, and I'm very, very proud of the work that has been done. Diana?
Thank you. Thank you, Supervisor Chavez and Cortese, for your support of older adults in our county. And I want especially a thank you for hosting the special hearing on older adult issues in September. We appreciate that very much. I have a few highlights from this year's accomplishments to share with you with 4 PowerPoint slides. And I'd like to give 2 shout-outs, one to Susan Chang, who's our senior management analyst, who makes everything that we put out beautiful and eye-appealing, so thanks to her. And also a shout-out to my boss, Jim Ramoni, on Boss's Day, and he has gotten nothing except a shout-out. And so, so that's all he's getting for Boss's Day from me. So thank you, Jim. In 2015, at the State of the County address, President Cortese announced the county's plan to pursue the designation of the World Health Organization's age-friendly status. The Seniors Agenda goal was to have not only the county but all 15 cities also join the global network of age-friendly cities by July of 2017. Our goal was officially reached last year, and this WHO's initiative has gained momentum with a number of age-friendly cities increasing from 200 cities in 36 countries when we started 3 years ago to currently they have 937 cities in 46 countries as of today. So this is a growing trend and has lots of momentum behind it. We joined the global network to share best practices and learnings, and of these communities, Santa Clara County is the first county in the United States to have all its cities designated as age-friendly. Our success has sparked Marin, San Mateo, Alameda, Sonoma, and Monterey counties to become age-friendly. San Francisco already beat us to it, but they only had one city and one county. I also have had the opportunity to share our age-friendly initiative at regional and national conferences. This designation is not a checklist, but a spirit of intentionality by elected officials and the community to evaluate policies and practices and programs through the lens of older adults, using the 8 domains of livability and creating new projects to support increased age-friendliness. An age-friendly city is an inclusive, accessible urban environment that promotes active aging. The Seniors Agenda is a backbone organization for a community collaboration to address the needs and gaps in services for older adults in our community. Ingredients for successfully providing the best services for our older adults include cross-agency collaboration, age-friendly events and trainings, and community-based action plans. A common expression in government, which we just heard today, is talking about silos and breaking down the silos. And as someone from Kansas who has actually been to a silo, I would say that breaking down silos spills all the grains and makes a big mess. But I also prefer to see myself as a farmer or a co-op farm agent who drives around from silo to silo, connecting us all together. As a connecting agency, the Seniors Agenda has been the catalyst in bringing agencies together to collaborate on projects benefiting older adults. So you can change the slide. This year, we have a couple of programs to highlight under the, back to the cross agency. There you go. So thank you, Justin. Okay. This year, the 5 volunteer driver programs, which provides 14,000 rides in the last year, came together, and they looked at how they can share best practices, how they can maybe use the same software and work together for possible funding together. This really has been with the county providing money through the ride, Reaching Your Destination Easily, as well as the city of Morgan Hill providing their new Getting Around Town. It really has increased the number of volunteer drivers and rides that they are giving older adults and where there is not a good transit options. Getting the word out about new programs is challenging with minimal marketing funds and also now in a very diffuse outlets of media. So the Seniors Agenda has been very instrumental in promoting the newly funded Santa Clara County House Sharing Program, which is operated by Catholic Charities. And at the end of the first year, which was in August, they had 23 matches made with the average rent of $866 a month between a 69-year-old homeowner on the average and a 56-year-old house seeker on the average. So this is also providing another option of trying to house people in our community. Age-friendly events and trainings include this award-winning film event of Lives Well Lived. This documentary film of over 40 interviews with older adults who had lives well lived was shown in Palo Alto, San Jose, and Morgan Hill. Assemblymember Ash Kalra was so excited about the film and its message that he arranged for it to be shown in Sacramento to the state legislature. The Senior Network Summits and other trainings provide the latest trends and research for free to community-based organizations, county staff, and community members. Our 2 summits this year was around an urban planning with Don Whedon and also an LGBT older adult issues. The next steps in our age-friendly 3-year plan. The first part of an age-friendly cycle, of a 5-year cycle, is the assessment So we consisted of a survey of 2,500 responses and 37 focus groups throughout the county involving 400 older adults and professionals in aging. We shared the key findings and started the priority setting with 2 community conversations attended by over 100 agencies. And in partnership with the SSA Office of Research and Evaluation, we held 9 domain-specific workshops last October, November to create the 3-year measurable outcomes using the LOGIC model. Then we got delayed as the epidemiologist was promoted to behavioral health, and so I continue to be a staff of 1. But we had great momentum in coming out with really good measurable outcomes. We are in the final phases of developing a 3-year plan of action informed by the age-friendly assessments we've done, and that's include the survey, focus groups, community conversations, LOGIC model workshops, and finally the recommendations that came out of the special hearing on older adults. The 3-year plan will be completed in the first quarter of 2020, and although we don't have an official plan in place, we have continued to create, transform, and expand age-friendly programs and policies. One example of our action items is to be included under the domain of civic engagement is outreach for the 2020 census. Our ambitious goal, which makes epidemiologists cringe when you put in 100%, will be your goal, is to have all staff trainings and participants and workshops at all 34 senior centers in the county. We are also the only county to have asked and requested specifically designed placemats for our over 40 senior dining sites as another way to get the outreach out about our 2020 census and how important that is for the county and for everyone to be counted. We appreciate the support of the Board of Supervisors for being the champions for older adults in our county and visionaries on how we can create age-friendly communities for all ages. Thank you for your time.
Thank you. Dave, did you have any comments?
Just thank you so much for all the incredible work that you're doing. It's just amazing to see the continued energy around convening people, making sure they're informed, assisting us in trying to roll out other programs, other initiatives to make sure that people are informed. I think that's what the special hearing was somewhat about, just trying to continue to build upon this work and knowing that we're going to have more and more people to reach out to as each and every year goes by. So thank you for continuing to establish great building blocks for the work that's coming in the future.
John, did you want to comment on this item?
Actually, I had a comment related to the previous
I'll
item.
come right back to you then. If I could, just a couple things I wanted to lift up and then just a question. It's actually been really exciting to see how well just the staff of 1 has done to create this really group of enthusiastic group of leaders across the county that are excited about this age-friendly movement and have stayed engaged, because I think one of the things I was worried about for you is just like you dog paddling by yourself and how would other people come along, but it feels like people are really excited about it. And second, I wondered if on the census issue, if you and that staff, if they're going to actually have a crew or a team of people that are particularly working with you on seniors, but on their ledger, so to speak, because we've got I know the board's put a little bit of money aside to do that really deep outreach.
Mm-hmm. So we have been on the planning committee with older adults for the Census 2020 and kind of working with that office just to say, here's the list of all the senior centers, this is where you should go, and let the senior centers know they'll be contacting them and kind of making that connection, and that, so that's what we've been doing.
So one recommendation, I think staff to staff, I mean, if we need to say this too, we can, but I actually think as they divide up who's taking what, I think seniors have a really unique challenge in that we've been trying to get them not to be tricked on the internet. And now that it's going to be internet based, I just think that's going to take a level of dedication from the census team to really have somebody whose job it is both to look at materials to make sure we're mindful of that, the size, the language, the mechanism for somebody to be able to demonstrate that something's valid. Like that may require us to have, the county's, on the county website, the names or the way to look. I'm not sure the right solution, but it does seem like they're going to need somebody in particular just because of the work that you and Dawn have done to show us what that demographic group looks like. It is huge. And if we don't properly count it, I'm not sure we can plan as well as we're going to want to.
Yeah, there has been a lot of work about how do you make, especially with people that aren't as technology savvy about that, and as well as the whole frauds and scams. And the other issue, you can still call up, and you can give people that option, as you can call up and they have all the languages available and do your 10 questions. It's like they say, it's only 10 questions for $2,000 per person. So what the county gets back. So I think that there's ways of just letting that be known, and we're also training senior center staff so they know how they could be helpful. The other issue was about whatever comes in the mail, alerting them what it is, because it's going to be the same time as the California primary, and we are going to get so much stuff in the mail in March about, elections. So what you see and what, so it's like, I don't know what they came up with, like sometimes you say, look for the pink envelope, look for the blue envelope, or look for this, so they'll know what their code is and stuff. So.
Well, one thing I hadn't thought about, but I think it would be interesting for you to take a look at is the American Community Survey, the one that gets done by that same group. I wonder if there's some lessons learned from the folks who've been doing those surveys because they're so off timing that we might be able to glean as it relates to seniors in particular. I don't know I have no idea who that local person is, but maybe someone from the census, our census team will know that, and maybe they figured something out that we don't know.
Yeah.
So. Great, well, congratulations.
Thank you. Thank you all for your support.
Thank you. And thanks for the report. So Jim, you're going to hang with us for a minute, but we're going to go to John for just a sec.
So I just wanted to mention, thank you, Chairperson Chavez, for the opportunity. I just wanted to mention to bring a little bit of clarity to the resolution of our discussion on the last item related to the San Jose Family Resource Center relocation, that I received word after we finished the conversation that there actually is a board referral already submitted for Tuesday's board agenda on this very same topic. So what I would suggest, and I can notify the clerk's office, is that we just pull over the committee report that you just heard as an attachment to that board referral. So in the context of that referral, you can have the discussion that you just referenced.
And just to clarify for Supervisor Chavez, that may be a referral from my office that got, through some confusion, did not go on the last board meeting, and I assume rolled over to the next board meeting.
Yes, it's my understanding that's the case.
Thank you for confirming that. I wasn't sure myself.
Thank you.
Absolutely. Thank you.
Good. All right.
Okay, next item. Yeah, I believe that's on. Good afternoon. Again, Jim Ramoni with the Department of Aging and Adult Services. I am joined with Terry Posley, our IHSS Social Services Program Manager. Terry is coming off of a move. The whole team moved over to the Julian campus last week, and so in the midst of all of the move activity was also getting ready for today's annual report. This IHSS annual report will highlight a lot of the work that's been done this past year, especially around efficiencies, as well as what's to come this next year, as Terry will highlight with respect to electronic visit verification and a lot of additional efforts that are going to be made by both the state and the local level to really encourage our consumers and our providers to go paperless with a lot of aspects of the IHSS program. So with that, I'll turn it over to Terry.
Good afternoon, Supervisors Chavez and Cortese and members of the committee. My name is Terry Posley, and I'm the IHSS Program Manager. Thank you for allowing me to quickly highlight the hard work completed this past fiscal year. We've been working diligently to prepare for next year's rollout of electronic visit verification. This is a new federal law that requires all states to implement electronic verification for Medicaid-funded personal care services by January 2020, and it impacts all IHSS recipients and providers. Providers will now be required to enter into the electronic system the date worked, the start time, and the end time of their shift. There have been many stakeholder meetings to create a system that would be user-friendly, efficient, and that would not disrupt the payroll process. A lot was taken into consideration in creating a system and process for users who prefer paper over electronic submission. Electronic visit verification will not change the number of IHSS hours, nor how where services are delivered. Geo-tracking or global positional system capabilities, otherwise known as GPS, will not be used. All counties in California are rolling out electronic visit verification in 6 waves. LA County has been participating in their pilot since July of this year and will end in December. Wave 1 begins in January. Santa Clara County is in Wave 3, which is May 1st, 2020 through June 30th. For providers to successfully submit their electronic verification information, all Santa Clara County recipients and providers must enroll in electronic timesheets by May 1st, 2020. This would ensure seamless payroll processing without disruption of payment. And this means that paper timesheets will become obsolete on May 1st as well. Santa Clara County has been working hard on spreading the word that paper timesheets are going away. Whenever we receive phone calls or lobby visits about payment discrepancies, our staff inform recipients and providers that enrolling in electronic timesheets will alleviate some of these discrepancies and that they will need to enroll by May 1st, 2020 anyway. Staff also refer them to electronic timesheet webinars that are on the California Department of Social Services website. Social workers are also informing recipients and providers during their home visits. And the public authority has incorporated electronic timesheets and electronic verification into their new provider orientation sessions. Last month, we mailed over 50,000 postcards to recipients and providers, reminding them to enroll in electronic timesheets because paper timesheets will be obsolete. When recipients and providers are resistant to enrolling in electronic timesheets, we tell them about direct deposit. When individuals enroll in direct deposit and then realize they receive payment quicker and directly to their bank accounts, sometimes the idea of electronic timesheets does not seem as daunting. And LA County has had some success with increasing enrollment just with the concept of trying out direct deposit first. We are hoping for assistance from the Board of Supervisors board aides when IHSS payment complaints are received. Getting the word out that we require 100% enrollment rate by May 1st, 2020 is imperative for electronic visit verification to be successful. And as you heard from Jim, last week on Monday, IHSS moved to our new location on 353 West Julian Street, and that's the beautiful building that you've been hearing about earlier. IHSS takes up the entire 5th floor. And we notified all of our recipients and providers of our building move on the other side of the postcard that reminded them to enroll in electronic timesheets. We know the word has gotten out because our lobby has been filled with recipients and providers the last couple of weeks. And IHSS has its own lobby on the 1st floor, complete with 4 receptionist windows in various languages to speak to our lobby visitors. Next week, the rest of the Department of Aging and Adult Services, which includes Adult Protective Services, Public Administrator, Guardian, Conservator, Senior Nutrition, and Seniors Agenda will move to the 4th floor. And all of Department of Aging and Adult Services will now be in one location. This will be the first time all 5 programs of DOS will be in the same building, which is very exciting for all of the programs. This concludes my presentation. Do you have any questions for me at this time?
I do, and so just a couple of questions. So one of the challenges that I have heard or gotten feedback on is the employers or the clients have to verify the time that people work, or if somebody in their family does that. And I'm wondering, do most of those families have adaptive tools that allow them also to do a web-based response to you?
We're finding that most of our clientele do have a smartphone. Some have iPads, laptops, that they do have the capability and they do have connectivity. It's just a matter of comfort level that some of them do not have, and that is a barrier.
So with the Los Angeles, with the folks who've gone before us, could you investigate whether or not they needed to do any kind of client training, for lack of a better word, and/or adaptive computer devices? I do know that for some low-income folks who are disabled, they have been able to have access to, you know, equipment, and I don't know if how they've gotten that equipment, if they've paid for it themselves. Some of it seems very expensive to have, depending on how severe your disability is. So I'd be interested in whether or not they had to do some sort of a program to make sure that folks did have access, particularly depending on their disability.
Okay, I'll find out.
And also, just on that same front, when somebody, I know for some clients, they have family members that have the capacity to help them. And in those instances, I'm presuming, Terry, that the family member is the formal guardian of the person, because if they're the formal guardian, they can fill it out, but if they don't have a formal guardian, that person's responsible for it. Is that accurate? The client?
I don't know if we have data on how many are formal guardians, but most relatives, most caregivers are the relatives of the IHSS recipient.
A parent, Supervisor Chavez, would have to become the legal, would not become the legal guardian, but for a developmentally
Maintain.
delayed adult that turns 18, there is a guardianship process that does have to be implemented. That's a small percentage of our population, but in those cases, those are individuals that we can work with.
And Jim, are those folks primarily have physical disabilities and developmental disabilities?
They can have both. We unfortunately seen a surge over the last number of years with just children who come to us with autistic spectrum disorders, who join the program at a very young age, and then of course can continue in the program for the remainder of their lives if they will benefit from the program.
If they have some sort of I'm assuming that we have a small portion of people that will still need to do we'll need a workaround for them. And the only reason this has come up is that today I met somebody who has a light sensitivity and also electromagnetic sensitivity. I'd never met anybody who had that before, and I don't know how they do anything now, right? So I would just want us to make sure that if we have a small pool of people, that we have a mechanism for responding to something that unique. And I don't imagine that's very many people at all, but we may have that problem or challenge. So I just had a couple of other questions. Those were, as we're talking about the making this change, how does that, if at all, impact current staffing levels?
It doesn't impact staffing levels because the information that will be entered into the system does not come to our staff. It's part of the electronic services app. So it doesn't affect our staffing at all. Our staff won't be doing any work related to the entering of the EVV data.
But when something doesn't go right, a payment doesn't come through, it's entered improperly, who deals with that?
They would probably get routed to our payroll manager, and then she would delegate to one of her payroll leads to address.
So Terry, one recommendation I would make is, again, let's ask the bigger counties that have already gone through this, because I know that, I know banking has changed dramatically, right? Like, so many people use their phone to bank now. But when there's a problem, the routing of that, depending on the institution you're with, can be really helpful or really not helpful. There's kind of almost nothing in between. So if they have a path for that, that would be great.
Okay.
And then I'm just looking at my notes for a second. I think I'm good. I think that answers my questions. Thank you.
Thank you.
Thank you.
And Jim, you're staying there?
I'm going to stay. Why don't you stay on? Let that Mary sit over here.
You know, actually, just Terry, while you're still sitting there, with the folks that are coming into the building, like folks that come in to get services or come in to get certified, what is the average wait time, or do we know what the average wait time for services are for them?
For the provider to receive payment?
I mean, for someone to be responded to who's standing in the lobby.
Oh, that's actually improved. It's down to between about a week or two for response time. That's as of today, but we're down staff. Again, we lost half of our staff due to various reasons, medical leave, things like that. And we think that the wait time is going to go up again, and Jim and I already strategized today how to address that backlog that we anticipate will happen. But right now, it's in about 1 week, about 5 days, where someone will get back to them.
So Terry, that sounds actually like a long time, depending on what your need is. But when you say we're short, I mean that the staff that's responding, who are they? Are they the clerical staff? Are they social workers? Are they both?
Their support staff, their classification is called Program Services Aide, and we have 6 of them, and right now in the office, we only have 3.
And are these program services aides, are they categorized right now? Like if I look them up on a sheet of all of our workers, their title is Program Services
Aide.
Program Services Aide?
Yes.
And then the social workers that you work with, what are they? Are they SW1s, 2s?
Social worker 1 and social worker 2 in IHSS.
And the social worker 1s and the social worker 2s that are there, the approximately how many of them are there? You said you had.
We have, let's see, 85 social workers at full capacity. Right now, we have in the mid-60s that are staffed and available. If we were fully staffed, we would have 85.
And by that, do you mean fully? You mean you don't mean they're funded, but you have some vacancies? Is that what you mean?
Yes, we
Okay.
have vacancies and we have some medical leaves as well.
And remind me, what's the total number of folks using IHSS right now?
25,000, I think 500 and some recipients.
And that's increased over the last few years by about, like maybe 8,000?
I think in my report it says 4%.
Roughly 4% growth increase per year.
Per year. So over the last 4 years, almost 16%.
Mm-hmm. Yes.
Thank you. Welcome.
So this is agenda item 7. Again, my name is Jim Ramoni. I'm the director of the Department of Aging and Adult Services. I'd like to introduce Mary Tinker, who is the director of our public authority for our IHSS Public Authority for Santa Clara County. Mary typically has the Public Authority Advisory Board chair present today's report, but unfortunately that individual was unable to attend today's meeting, so Mary is pinch hitting for us today. So thank you, Mary.
Thank you for letting me come and present the annual report for the Public Authority. I'm not going to waste a whole lot of time going into details on the report. You have a copy of that. If we look at the next page here, hold on, it's not working. Oh, it's working up there, it's not working. Okay, okay, hold on, let me back it up. I apologize. Okay, so you know that the Public Authority, we have some mandates. One of the mandates is to provide a registry of pre-screened providers, and the pre-screening is actually a very labor-intensive proposition for us. So we have to interview, we provide a 3-hour training, we check their references, they are required to go through a Department of Justice background check before we ever add them to the registry, and this is in addition to what they have to go through to become an IHSS provider, going through the enrollment process. We also provide training for the IHSS consumers and providers, and this last year we had 15 different classes, and we have a list of those in the annual report at various locations. I think there's 5 or 6 different locations around the county. We were able to expand that. So we had 130 classes that we provided, and we just started releasing the incentive payments for the classes that people completed in September. So it's moving along nicely. We also administer the health, dental, and vision, as well as the transportation benefits for the IHSS providers, and that is a tremendous amount of work. We have 3 staff members who are administering all of those benefits, so we've got over 12,000 that are enrolled in Valley Health Plan, in the dental plan, and in the vision plan, and those are done separately. We also have the enrollment that we provide for all brand-new people coming into the program to be a provider. And we have between 500 and 600 new people coming in, going through the enrollment process on a weekly basis, or excuse me, a monthly basis. That includes 2 group sessions that we do every week for an hour and a half, as well as in-person appointments, because they have to go through a whole process and we have to take fingerprints. We get all of their background to be able to determine if they're eligible based on what the state criteria is. We act as the employer of record for collective bargaining and provide staff support for the advisory board, and that's kind of what I'm doing here today. So on the next slide, it's a little hard to tell the way that it looks there, but I had to combine them so that I'd stay within your 4 limit. So the upper pie chart there is actually the number of consumers, and I think in talking about what some of the questions that Supervisor Chavez you had for Terry regarding the growth of the program, I think this actually highlights it a little bit better, because this is taking a comparison between, so the top one shows the consumers, so the base is about 76%, so that's the 18,969 of the consumers, that's our base. And the growth, like they said, is about 4% on an overall annual basis. But where the real big workload comes in is the amount of turnover that takes place. And that's something that until now we really hadn't put into numbers to really identify, because we know the workload is growing, the caseload is growing, but the number of returns, and it requires a lot of work to get people back into the program, the consumers. So that one there is about 20% turnover, meaning people returning to the program on a regular basis. You look at the other pie chart.
Mary,
Yes.
do you mind just say more about that population and why they have that particular?
Why they would return?
Well, why they return and unreturn, like what is that?
Okay, so what there are a lot of reasons that somebody would return. So for example, somebody may have moved out of the area and then they've come back, or it may be that they lost their provider and they decided to do something different and they went off of IHSS. It may be that they were hospitalized for a while and, so they went off of the program, and then when they came back, there's a whole reassessment that has to happen. I mean, Terry could talk more to all of the work on her side, but there's work on our side as well that has to happen whenever somebody goes out of the program for whatever reason and then comes back into the program. And that is the same thing both on that's the consumer side. On the provider side, it may be that they moved out of the area for a while and came back. It may be that, they got other work and they did that for a while, but it didn't pan out or it's not enough, so then they come back and they want to re-enroll as an IHSS provider.
But that piece of the pie, so this is additive, right? It's the 19,000 rounded with the 5,000 plus the almost 1,000 if I were to look at that first pie chart, or am I looking at?
Okay, so the first pie chart, the 18,000, almost 19,000, that's sort of the base that we're.
But the total services being provided is all 3
Correct.
Slices? Okay.
Correct. Mm-hmm. And then if you look at the second pie chart, the base there is about 68% of the population. That's the base of the workers. We have a higher turnover for the providers, and so the turnover rate for the providers is 28%, And so that's 7,071 providers last year that it was turnover, where they left and then they came back. So, and again, about a 4% growth rate overall. So when you're talking about the providers, we're talking about, if they've been gone longer than a year, then they have to go through the enrollment process again. If they've left and they're no longer getting benefits. Now with the benefits, if they go away for 3 months, 4 months actually, and they're no longer enrolled in benefits, then we have to completely re-enroll them into benefits and go through the whole process again. So the point of all of this is to say, when we're looking at the workload, typically we're not including that, but that is part of what the workload is, both for the Public Authority and for IHSS. And one of the things that the advisory board is responsible for is to make known to the IHSS staff, as well as you as the Board of Supervisors, and me for the Public Authority work that we do, recommendations. And the recommendation that the advisory board would like to make this year to this body is to, thank you. So the recommendation is that the turnover of IHSS consumers and providers severely impacts the workload, upwards of 20 and 27%, like I showed you in the pie chart. IHSS is teetering on the edge of non-compliance with the state at a 79.9% and ranks 54th among the counties. The advisory board ask this year is to approve hiring 2 account clerks, 2 office specialists, 2 client service technicians, and 1 data office specialist to fix the ongoing workload issues and improve customer service, because they really dove in this year and they really wanted to do some detailed work to find out what exactly could help in a long-term situation as opposed to extra help.
Yes, and I actually, one of the outcomes of today is that I really would like to agendize a staffing discussion, but what I wanted to do, John, is I wanted to actually give you an opportunity to give some thought about how this should come back and be presented. So there were 2 issues that I was very interested in. One is 3. Issue number 1 is whether or not we should be focused on increasing staffing versus short-term extra help approaches and or overtime. So that's one issue. The second issue is that I am very concerned about the way the workers are classified. I've had discussions with both advocates and the workers, and there's a lot of consternation over the type of work they do. And frankly, I have a concern also that I have had an opportunity to raise with Dr. Smith, but it also has to do with just how we look at the long-term growth, particularly just because of the size of this body of work. I think, the amount of services and clients that you all are juggling is amazing. I mean, this is a huge number of cases, and frankly, given the number of people that we have who are getting these services, the limited number of complaints we're getting is actually kind of remarkable, so congratulations on that. What I would say is that I am really interested in the classification of these workers. I'm also interested in concerns about the environment within this department. In part, I think, has much more to do with the volume of the work that is being done. And I actually really appreciate the slides around the churning, because that is the first time I've actually seen the complexity of those 2 pieces. And so it was hard for me to understand why people were, even some of the feedback we were getting directly from both clients and employees, until I saw that. So I think what I'd like to do is start with that chart and have a conversation about how we both make sure that the timing is not a week. I mean, these are pretty sick people, that we're able to be more responsive as we're trying to hire people, particularly in this really competitive market. Like, I think we got to figure out whether or not we can drop that, almost 30% of that churn on the employee side. And also, I think from a work satisfaction perspective, I'd like us to take a look at the way that could be structured in a way that creates less stress and more productivity in that environment. So I want to make this as a referral to come back, but I wanted to make sure that I gave you a chance to think about it and didn't try to make decisions on the fly. So I'd like to be able to have this discussion in December before budget.
Yeah, and thank you for the opportunity to comment. To your point, and given, sort of the multifaceted nature of the issues that you raised, this would require some degree of collaboration between Employee Services Agency and the department and the Office of Budget and Analysis related to the first issue that you raised about sort of the staffing and potentially increasing the staffing to deal with the increased workload, and what's the appropriate staffing model in terms of permanent staff versus extra help versus overtime. That will require us to sit down with the department and with OBA and just analyze their workload and their projections given the caseload growth and the demographics and where things are planning to go, and then also to get a sense of timing and how to keep up with the growth. The classification issues that you raised are sort of woven through that, and depending upon how the nature of the work has changed over time, that speaks to whether or not the classifications are still current, I guess, is a way I would characterize that. And then we could, in terms of the staffing model and the nature of the work, sort of another prong of that analysis is, are the classifications that are there appropriate to address the nature of the work, or does something need to be adjusted to accommodate that? And my sense is, to the extent progress is made on 1 and 2, then that would address sort of your third point about just the sort of satisfaction related to the work environment and how the work is being addressed and handled. I think that follows from that.
So if we can have that back, that discussion in December, I want to have it as close to mid-year as we can, in part because I actually was hoping this would be addressed sooner, but I don't think that's just going to happen magically. So I'm going to agendize it, and if not in December, then what I'm going to do is make recommendations based on the information we have to the board. But I'd like that to happen with your input before we do that.
Absolutely.
So December is now, if you want to bring a process back sooner so that we have a timeline, I'm fine with that too. But I don't want that December date to slip too far. I mean January. December, January.
Yeah. No. And to your point, a December, January conversation precedes the typical timeline of the mid-year budget review in February. So, and I think from the administration perspective, we would welcome more conversation and fleshing out of this than less. So it would be opportune to have the committee conversation in advance of mid-year.
Great, very good. Anything else that you all want to add?
I just want to hope everyone is recalling that Harvey Rose is currently studying the program as well. So a lot of the conversation that just occurred, I think that would be very helpful to engage them in some of their preliminary work thus far, because a lot of these same issues, Supervisor Chavez, that you and Supervisor Cortese have raised in the preliminary.
Thank you for the reminder.
Is underway. Mm-hmm.
What's do you happen to know the timeline on the completion of that?
I believe that they had indicated we commenced in August, and I know that they're diligently working now. I want to say that they had indicated that by March they would have their findings by March.
Yeah, it's late in the year, but I'll talk to them because we have a meeting FGOC, so I can talk to Cheryl tomorrow. But thank you for the reminder.
Thank you.
Anything else on this issue? No, so we'll have this come back no later than January, but hopefully for at least a preliminary discussion in December, and then we can, and then, you know what, and that's a good point, and we'll talk to Cheryl about their timing as well. Happy last meeting. Congratulations for, how long have you worked for the county? Yeah, in my 30th year. Shush. Wow. Happy anniversary. Well, anyway, congratulations for your last meeting. We're going to move to item 10, which I meant to put on consent. I know, and I'm so sorry. I thought I did, and I got confused. And so, do you have any? Do you want to talk, or can I just put it? Can I just say yay? Yay! Thank you for the good work on changing the bylaws. All right, without objection, that passes. Thank you. Sorry, I'm so sorry. And then we're going to go, Bob, to you.
So good afternoon. Just wanted to mention the status update on a couple of the legislative pieces that have been floating around Sacramento, and just waiting for the final resolution of the signing/his veto exercise. There were two key bills that the county welfare directors had supported that were signed. One was the modernization of what we call PARP, and that's just the private agency adoption reimbursement program. There was a lot of confusion around how that program was funded, who was controlling the realignment funding on it, and this provides some clarity. Where this is helpful is just around helping free up some of the work that we're doing with CCR and clarifying roles, as well as giving us control over the funding to help reform what's happening under CCR. The other bill we wanted to talk about was just AB 1377. Which is an automatic student eligibility for CalFresh, and this is for students who are enrolled in free and reduced lunch. Now we'll create a system for automatic eligibility for CalFresh benefits, and we're obviously very excited about that. And happy to take any questions.
So, is he not done signing bills, or?
I think we're right at that point of where
like
he doesn't.
Keeping
then
hope
it becomes,
alive?
Yeah,
like,
yeah.
okay. Ignacio.
Thank you. I also have two updates on bills. Unfortunately, these two are vetoes by the governor. Senate Bill 337, which I previously discussed in the committee, to increase the amount of child support passed through to families for $100 for families with one child and $200 for families with two or more children, was vetoed by the governor, primarily because of the high cost to the state of those costs that would be passed along. Assembly Bill 1092, which I think I most recently discussed with the committee, which would reduce the 10% interest charge on child support, which is welfare recoupment, that is owed to the county and the state, would have reduced the 10% interest to zero. That was also vetoed by the governor because of the impact of hundreds of millions of dollars to the state general fund. And so he urged the Department of Child Support Services in Sacramento to review and consider changes to some of their other programs to offset the impact of the high interest on that debt. So we'll be going back to work with the State Department on that through our association.
Can you remind me, who was the author of the second bill?
Assembly Bill 1092, Joan Sawyer.
Thank you. Well, keep in there. I mean, it's the right direction.
Yeah.
So thank you for that. All right. So with that, we are adjourned until our next regular meeting, which will be Monday, November 25th. Thank you, everyone.